And the next speaker is Dr. Chao Ming Chen, and the topic is safety and efficacy validation of Patella Cryo-free method during recycled frozen autograft procedure for proximal tibial malignant bone tumors.
Good morning, ladies and gentlemen. After proximal tibia malignancy excision, we can reconstruct the patient with either tumor prosthesis, also chondral bone graft, as well as bone prosthesis composite. The BPC combines both advantage of tumor prosthesis and also chondral bone graft, but due to limited sources of autograft in Asian society, we prefer recycled autograft in elective cases. But how can we preserve patients' extensor function in the proximal tibia setting? During the tumor excision of a proximal tibia, we would routinely do the patella chevron osteotomy. And after tumor eradication procedure and the prosthesis composition, we would fix the patella with cannulated screws and a tension band wire, which we believe could preserve the better extensor function for the patient. However, many studies have shown that either gamma radiation or freezing might have negative effects on ligament and the bone, which might interfere the patella healing and its function. So in last APMSTS in Singapore, we present our clinical result of Patella Cryo-free method. And today we are going to use temperature curve, histological analysis, and a tunnel assay on bone and cartilage to prove that the efficacy of Patella Cryo-free method when compared with traditional patella freezing. Proximal tibia, and along with patella and its tendon, were harvested from swine of legal lifestyle chambers, and we divided these samples in two groups. In traditional patella freezing method, the proximal tibia, along with patella tendon and the patella, were all immersed in liquid nitrogen for 20 minutes, just as what we do routinely in the surgery room, and followed by the slow thawing to room temperature for another 15 minutes. In the Patella Cryo-free method, we wrap the patella along with the patella tendon, and then we put the proximal tibia into a specially designed freezing box during freezing, while we keep the patella and the patella tendon exteriorly and rinse with lots of warm water during freezing. And our temperature curve shows that we can keep the patella in room temperature, while tibia and its tuberosity could achieve desired temperature required to kill tumor cells during freezing. And the histological analysis of normal tibia without any treatment, we can find that the osteoblast and surrounding mesenchymal tissues adhere to osteoid tightly. But after freezing of the tibia, we can observe that the desistance of osteoblast from surrounding mesenchymal tissue, which is observed in both tibia of group A and group B. However, in the patella setting, the normal patella still show the osteoblast and the surrounding mesenchymal tissue adhere to each other tightly, and this similar result is observed in the cryo-free patella of the group B. However, after the freezing, we can observe the frozen patella in group A. The fragmentation of osteoid was observed, and the desistance of osteoblasts from surrounding stroma tissue were also noted, which suggests that with a cryo-free method, we can preserve better patella healing potential after freezation. In cartilage, the normal cartilage, we can observe there's no shrinkage or thermal contraction of a chondrocyte nucleus. But this same situation is also observed in the cryo-free patella of group B. However, after freezing, we can observe the patella cartilage, the frozen patella cartilage has shown the shrinkage and thermal contraction of a chondrocyte nucleus, which suggests in the future, the frozen patella patient might have higher risk with OA change. The tunnel stains can stain the dead cells in apo-BRDU staining. And in both frozen tibia of both groups, the tibia cells were all dead, which shows that the tibia tumor can be eradicated in both groups. In the patella setting, the frozen patella show all the cells dead, which is not observed in the cryo-free patella of group B. And the patella cryo-free method could preserve more biological activity for healing. As to the cartilage, we can observe that the frozen patella of group A, the chondrocytes were all dead in apo-BRDU staining, which is not observed in the cryo-free patella. And the Patella Cryo-free method protects patella from cryo injury during freezing. Our previous data has showed that in the traditional patella freezing method, patients has relative poor range of motion, but both groups could achieve reliable local tumor control. But in the patella freezing method, there might be higher risk of patella complications such as malunion, non-union, as well as migration of the implant, which is not observed in the Patella Cryo-free method. And our study has proved that with a Patella Cryo-free method, we could preserve the innocent patella, but tibia and its tubosity could achieve desired temperature required to kill tumor cells during freezing. And so we believe that the Patella Cryo-free techniques in frozen recycled autografts could preserve the innocent patella and then reduce the complication of patella and achieve reliable local tumor control, as well as provide the patient with better clinical outcomes for proximal tibia malignancy. Thank you for your attention. I really appreciate it.
Thank you very much.